President, I want to thank my colleague from North Carolina for organizing the freshmen one more time as we've come out for the last 4 or 5 weeks in groups of 8, 9, 10, or 11 freshmen to talk about our vision for healthcare reform. We invite our colleagues not only on our side of the aisle, but our colleagues across the aisle to join us in this kind of conversation about how we get healthcare reform right. I also want to commend my colleague from New Hampshire, Senator Shaheen's comments about how we try to get the financial incentives right around healthcare delivery reform, and I think her REDUCE Act components ought to be clearly part of any overall healthcare reform that we take on. And I want to pick up actually where Senator Shaheen left off and talk about how we try to readjust our financial incentives around healthcare. We've got them all wrong. We've got a healthcare system right now that rewards bad practices. We've got a healthcare system now that rewards a hospital for multiple readmissions over a hospital that has a low readmission rate. We have a healthcare system now that rewards volume of care rather than quality of care. And healthcare system delivery reform and reforming our financial incentives has to be a key component of any part of healthcare reform going forward. I want to join my other colleagues. I know I heard from Senator Udall from New Mexico as well. As we've all cited examples in our own state, I want to very quickly go through 3 examples in the Commonwealth of Virginia. In 2000, the VCU health system in Richmond, our capital, developed a program called Virginia Coordinated Care to manage the health care services for the uninsured in the city of Richmond. I know, Mr. President, whether you've got an uninsured person in Richmond or an uninsured person in Little Rock, they often come to the emergency room door to be admitted. They get treated for their episodic illness. They go back oftentimes into a situation. There's no continuity of care, and oftentimes that uninsured person will show back up on that same hospital's doorstep or on another hospital ER doorstep at some other point because there's been no management of that individual's case during his period outside of being treated for the episodic incident. What VCU developed was a program that assigned one primary care physician to oversee each uninsured person's patient's health. The goal was to increase coordination between doctors, hospitals, and as a result, increase accountability, improve quality of care, and lower cost. This Virginia Coordinated Care Program started with a couple of folks in 2000. By 2009, there were over 20,000 members. And one of the most significant outcomes of the program was a significant drop in emergency room visits by enrolled patients. Between 2000 and 2005, emergency room visits dropped 14% by having this kind of continuity of care. As well, these patients didn't show up at other emergency rooms. They were treated earlier in the prognosis of their illness and for an overall better delivery of healthcare system. Another example took place in another end of our state, Sentara Healthcare, located in Norfolk, Virginia. In 1999, Sentara studies found that intensive care units that were monitored by a doctor full-time had lower mortality rates and shorter length of stays than those that were not. In order to improve the quality of care, Sentara worked with a company called VisiQ to install web-based television cameras in each patient's room. With this technology, a single physician in a central location can follow patients in multiple rooms at the same time. Again, this kind of logical approach produced a more efficient care at lower cost. Sentara saw a 25% reduction in mortality amongst these patients, a 17% reduction in length of stay, and a 150% return on investment in the program. Again, trying to bring a different reform of delivery and a different reform of how we pay. Perhaps the best example, and one that I hope our overall healthcare reform efforts will lead us to, is now being modeled by the Carilion Clinic in Roanoke, Virginia. Carilion Clinic is a multi-specialty healthcare organization with more than 600 doctors and 8 healthcare organizations. In 2010, next year, Carilion Clinic will join with Engelberg Center for Healthcare Reform at Brookings and Dartmouth Institute for Health Policy to implement a new and innovative healthcare model that rewards providers for improving patient healthcare outcomes while also lowering cost. This accountable care organization, we hear a lot these days about accountable care organizations, will encourage physicians, hospitals, insurance companies, and the government to work together to coordinate care, improve quality, and reduce costs. Under this model, providers will assume greater responsibility not just for treating the patient's illness, but for the overall quality and cost of care they deliver. They will actually be incentivized to take steps to keep the patients healthy while avoiding costly medications and procedures. This model will encourage and make it affordable for doctors to finally practice preventive care. Now, Carilion Clinic is doing the right thing, moving away from our current very flawed system that basically is based upon fee-for-service. As long as we have a healthcare system, 1/6 of our economy, that rewards providers simply based on the quality of care they produce, rather on the quantity of care, rather than on the quality of care, then we're never going to get healthcare reform right. If we do coordinated care, we can have higher quality care at lower costs. We can focus on the health of patients, not the number of procedures, and we'll have smarter financial incentives. We have to make this delivery system reform and getting the financial incentives right a key part of healthcare reform. I know my freshman colleagues stand ready to work with our colleagues on this side of the aisle, and again, I invite the colleagues on the other side of the aisle to join us in this effort. Getting it right can lead to improved quality of care for all Americans. It can lead to lower costs, and it can lead to a healthier America.